All right, welcome back. Welcome to part two. Thank you for your patience. I had another meeting I had to go to. So now I would love to finish up. We are looking at, as soon as I get situated, there we go. Week 8, we were on the overview. There we go. And we had gone through the assignments. I have posted part 1 with the transcript. And so as soon as I'm done processing this on YouTube, then I will post that as well. We went over the assignments. So now what I would like to do is go over the overview and the lessons. So let's go to the overview. So again, you'll see this will be your home page. This link will take you back to the module. So let's go back and look at the module and see what we have going on there. Let me put this in student view. There we go. View as student. There we go. Make it turn pink. There we go. All right. We don't need all of those, do we? No, because we are in week 8. So we shall collapse those. All right. So we are in week 8. So we will look at the overview and the lessons. We talked about the assignments. You do have your growth and development journals. Make sure that you are looking at the due dates on these so that these will get rolled out. And your health promotion campaign should be turned in. If you still have questions, let me know. I'm happy to work with you on that. There's your quiz, again, opened at noon today. I will do my best to stay on top of those. And so now we're going to go over the lessons and take a look at those. So, course objectives. So this is last summer's walkthrough. I will post parts 1 and part 2 for this summer. And our objectives, again, a lot of the same ones because we're going through the lifespan stages and some specific ones related to various stages, being at the end of life, dying process, end of life care and bereavement. And so let's start with loss, grief, mourning, and bereavement. So this is lesson 1. Now this is last summer's video of lesson 1. So you can look at that in detail. And here is your reading. So again, it will tell you where to go with that. You can do, I love Lumen Learning. I think Lumen Learning is amazing. It tells you, why it matters, death and dying, common causes, emotions, process, stages of loss. There's palliative care and hospice, all those kind of things. There's physician-assisted suicide, all parts of the, there's the bucket list of the lesson. So that is there for you, Lally French Valentine French. And then Course Hero also has a couple lessons that I think are very pertinent to this one, 5 stages of loss, when we're talking about Kubler-Ross, denial, anger, bargaining, depression, and acceptance. And as I mentioned previously, that can be, it doesn't have to go in that particular order. Grief can take, can switch it around. We did learn that eventually. And then bereavement and grief. So bereavement is the outward expression of grief. So mourning, M-O-U-R, like to mourn something, and funeral rites are expressions of loss that reflect personal and cultural beliefs. So that's why we're wanting to ask people how we can support them with their personal, cultural, spiritual beliefs. And so here are some examples there. Grief talks about anticipatory grief, disenfranchised grief, which I think disenfranchised grief is a tough one because it's experienced by people who have to hide circumstances of their loss or whose grief goes unrecognized by others. So a pet, for example, although I don't particularly think that's disenfranchised grief because people are pretty sad when they lose a pet. But there could be something some person that nobody's really aware of, some weird, I don't know, some weird thing that you're grieving, but it's still a loss. It's still grief. So it's good to be aware of those feelings. And then we did already talk about reflections on loss and supporting someone experiencing grief. And we talked about the looking at the poem and doing a reflection on the poem. So let us look at the lesson. And again, this will take you back to the overview. And so this is another little poem. Teach me to die. Teach me to die. Hold on to my hand. I have so many questions, things I don't understand. Teach me to die. Give all you can give. If you teach me of dying, I'll teach you to live. So I kind of like that one as well. And so being able to distinguish between grief, mourning, and bereavement, we talked a little bit about that. Most people know Kubler-Ross, so you'll be introduced to Bowlby and Warden. Many people are not aware of their theories. I'm talking about functional, dysfunctional, or what's also known as complicated grief, anticipatory grief. Anticipatory grief, you know it's coming. You can anticipate that it's coming. Generally with a chronic illness, somebody in hospice care, we know it's coming. We're just not sure when. How do we recognize components of complicated grief? And what is our role in facilitating someone through the process of grief and loss? So again, there are your readings, your activities, and here is the lesson. So there's a PowerPoint from last year, and then stages of grief. Talking about it's time to let the 5 stages of grief die. I thought that was a very clever title. This should be, yes, an article from McGill University, which is actually in Canada. I actually was accepted there when I was going to college, but I ended up staying in the United States, went to UC Davis. And so this talks about that. Is this really what, because this is from 1969. So this is what, 50 some years old. And so it walks you through Kubler-Ross's theory there. And then I thought this one was also interesting. 16 different types of grief that people might experience. This is written by a licensed social worker and from 2022, updated there. Normal grief. How do you feel when you have grief? Physical reactions, behaviors, emotional reactions. There's many different ways, outward appearances of grief. And there can be loneliness and pain. It's a big deal. Anticipatory grief, we talked about. If you know that the death is coming soon, sometimes that's a good thing, sometimes it's not. Complicated grief, when the grieving process does not move all the way through the steps of grief. So it can be prolonged, it can be much more intense, and you don't function well. There's an inability to function if you have complicated grief. I tend to think of that as being longer than 6 months is usually the way I think of that. And it's also like a roller coaster. Okay, I feel better. Oh man, no, I feel okay, yeah. And often you'll need to suggest mental health services to help the person work through their grief. Chronic grief results when the extremely intense reactions to loss do not subside. They don't go away. So chronic grief lasts for a very long time. I guess you would say it could be a type of complicated grief. You have distress that continues to intensify. You have difficulty making much, if any, progress, moving through your grief so you can heal. So it's another type of complicated grief. Although I tend to think of complicated grief as a more emotional grief. Chronic grief, I tend to think of as sort of a sadness grief that may not be as recognizable to others as complicated grief. Delayed grief, happens if you're experiencing feelings of sorrow and longing, and then even if someone died a long, long time ago, and now you have the grief feelings of that. Distorted grief, cumulative grief, exaggerated grief. You don't need to know all of these, just the complicated, anticipatory, the disenfranchised grief, this one, which is ambiguous, trauma, collective grief, entire community, inhibited or abbreviated, and absent grief. And then it gives you some resources there as well. We did talk about Kubler-Ross, so let's take a look at Bowlby. And you have a couple more articles there. Again, this is an older article, but Bowlby's stages have been around for a long time. When he came up with his theory. Let me go down and find. So 1969. So again, another older theory, Kubler-Ross's as well. I don't know. I've been thinking like, what? We have these theories. We have these theorists. We have Kubler-Ross. We have Erikson, Piaget, and their theories all came to pass in the 60s and 70s. That's 50 years ago, 60 years ago now for some. I don't know. Is it true? Do those things still hold true? In what way has today's society changed the way that those theories look? You know, we have technology we didn't have back then. The world has changed. I just often think about that. Is there some way, do those theories still hold true? And this is why I bring up Bowlby and Warden, because I like the way that their phases work. So Bowlby, it's actually Bowlby and Parks, but most people just say Bowlby. And these are 4 phases of grief. So this is grief. Phase 1 being shock and numbness. So the grief, it's reaction to a loss. I am in disbelief. I don't understand. I'm in shock. Why did this happen? Can't really feel anything because it's such an intense feeling of loss and grief. And then phase 2 is called yearning and searching. So yearning is like a feeling of wanting something, like I have to have something, I'm missing it, I want it back, I need it, and looking for it. So yearning, you know, I lost this person, I'm yearning to have them back, I'm searching to find some way to bring them back, not physically necessarily, but to remember them, to hold on to them. And then going through a phase of despair and disorganization. And so I'm not getting them back. I was in shock and I was searching and they're not coming back. And so I'm in despair. I'm very sad. Disorganization. I don't know what to do with myself. I don't know how to be a person without this other person around. Oftentimes memory loss, those emotional reactions come out. And then finally, the 4th phase, reorganization and recovery. So being able to sort of reorganize your life now without that person present, and recovering back to a sort of where I can function day to day. Not that we ever forget. That's not how that happens, but we can continue to move forward. And so it just goes on to continue to talk about those stages. So I think that's a different way, very similar to Kubler-Ross, but 4 stages, and I think encompasses a little bit more broader definitions, if you will. And then if we look back at Warden's 4 tests of mourning, so now we're talking about mourning. And so tasks of mourning. So how mourning being as bereavement, an outward cultural, spiritual, outward showing of my grief. How do I mourn? In what ways do I mourn? Excuse me. And so there are 4 tasks of mourning. Task 1 is to accept the reality of the loss, understand that the person is gone, they are not coming back, and there's nothing we can do to bring them back. We have done our best to spend time with them, and accepting is difficult. That can take a while. And then task 2 is to work through the pain and grief. So I know they're not coming back. I have pain. I am sad. I am angry. I'm all these different feelings. So I think when you say the pain of grief, again, it's much more encompassing than depression or anger, things like that. It can encompass so many more feelings. So working through doesn't mean you're getting over it, because we don't ever get over it. We work through our feelings and we move forward and through the pain of grief. And then this is, I think, my favorite one, 3, and 4 of any of these theories, to adjust to an environment in which the deceased is missing. So very similar to Bowlby in the way that, how do I keep going? How do I keep going without this person? Um, how do I do the things for myself that that person used to do for me? How do I fill the void that they have left? And so again, that can take many forms as well. I like the way that they have the lightning here. It's kind of like weather, right? So it's lightning, um, and because there's the reality of the loss, and then it starts raining. It's like a torrential downpour. I think working through that pain. It's gray. It's dark. It's wet. It's messy. And then task 3, we have an umbrella. We have a little. We're protecting ourselves a little bit, and we are going to move forward, not move through. And then to find an enduring, number 4, to find an enduring connection with the deceased while embarking on a new life. And that's where the sun comes out. We can see the sun through the clouds. And so to find an enduring connection, so with the deceased while embarking on a new life. So this new life is a new life without this person, but without this person physically, right? But I still have a connection while I'm still moving through my grief, and getting my grief doesn't necessarily go away. It will, grief is something that will come and go. Oftentimes I'll hear a song or smell a smell like a perfume or a cologne or something. My mom passed 15 years ago, my dad 25 years ago. And every so often, like a flavor of ice cream or something, I see Baskin Robbins and I think of my dad, or because we used to have ice cream a lot, or I smell something that smells like my mom's perfume, and that brings a feeling, I get like, I don't know, not butterflies, kind of like a knot in my stomach a little bit, and then I have to kind of pause, reflect, acknowledge the feelings, and then I'm good. I move through. I have lots of pictures. I have little mementos, things that help me deal with that. So, and then it talks about, gives you an idea of what those tasks are. So that's why I like those theories. I think they're a little, they're not so restrictive, I think. Changing the way we mourn. I've been playing this one for a long time, as well as this one. We don't move on, like move on. People say, come on, get over it, move on, keep going, move on. We don't do that. We just move forward with our grief. We can't get away from the grief. We move forward with it, and it dissipates and gets less and less and less, but it doesn't necessarily always go away, because it will come back every so often. So I really like those videos. I think those are good ways to think, and good ways as healthcare professionals that we can help people work through those. And then again, there's the poem analysis. And that is that lesson. So if we go down to the bottom and go next, we'll go to the second lesson, which is actually the process of dying and looking at end of life care. And so again, there is the video from last summer. This will take you back to the overview. And then death and dying and end of life care, the outcomes, the goals that we're looking at, concept of death and dying according to developmental stage. So we have spent this course looking I'd like to bring back evidence-based practice, because we looked at that in the beginning, the scientific method and how we get here. That's what all of these are. These are theories, right, which are based on evidence, and how we have a hypothesis and then we come to these conclusions. So looking at cultural aspects of death, signs that are common to impending death, so that you may know somebody's close to death, comparing and contrasting hospice and palliative, care, looking at living wills, do not resuscitate orders, ethical concerns, and our role as the healthcare provider in end of life care. And so again, there's your reading. Of course, here I really had some nice information, really succinct information on causes of death, process of dying, palliative care and hospice, and euthanasia. Again, this is very personal information. Everybody takes this in different ways. So please take care of yourselves, read it in small chunks if you need to, whatever works best for you, which is also why I don't go in, at least right now, into a lot of detail, because I want y'all to work through that in the way that works best for you. We reviewed the bucket list and the journal. And so now we're going to go through and look at the objectives. So palliative versus hospice care. I love this visual hospice services. This is one of the main differences between hospice and palliative care is who pays for it. So hospice services are paid by Medicare, Medicaid, and insurance, whereas palliative services are usually paid by insurance and also self-pay. The hospice we mentioned earlier in the first part, prognosis 6 months or less, although you can renew every 6 months. There is a renewal process. And there is no curative treatment. You cannot, like you can go to the doctor for follow-up, but there's not a specific curative treatment that's going on. And it happens wherever the patient calls home. It can be in the home, it can be in the long-term care, it can be wherever. And then palliative services could be at any stage of the disease. So this can go on for a very long time. You can still be having curative treatment because sometimes treatment, chemo, things like that are painful. Will typically happen in the hospital, although could happen at home or in long-term care facilities. And they both together, they provide comfort, reduce stress, symptom relief. And I think that helps the loved ones in the family as well to see that their family member isn't suffering as much as we don't want them to suffer. So that's a good thing. I gave you a couple references here for a palliative performance scale, where somebody is on the scale of palliative care, palliative sedation, therapy guidelines for that, just FYI. There's also something called a modified caregiver strain index. So as the support person for this terminally ill person or person nearing the end of life, regardless of what age, that person that's providing the support can experience strain and stress, physically, mentally, emotionally. And so there's actually a way that we as healthcare professionals can gauge where they are and how much help and support that they might need as well. And then these articles go into the difference for living wills, advanced directives, healthcare documents that you should have. Always good to have a will ready. And then when patients die, a guide for nurses, how do we take care of ourselves, right? We're talking about the role of the healthcare provider, regardless of what job you have, right? So nurses, therapists, RCP, respiratory care. When patients die, what do we do? How do we prepare the body? Do we, if we had to do resuscitation, for example, we have the family come in and take a look at their loved one. Usually nowadays they're usually in the room with them when we're performing the resuscitation. There are a couple more PowerPoint presentations here. There are videos in the PowerPoints. There's some videos here as well. They might be difficult to watch just because they're really sad. And that's okay. The reason I have them posted is because to me, they speak to specific points of being a healthcare professional and providing caring and compassionate care for people who are dying. And so this is actually a former nurse who's dying from cancer, and shares her experience with nursing students. So I thought that was it's really nice. And then the rest of the videos, I think most of them talk about what will you see as a healthcare professional? What might you see in the final weeks or days of life? What can you expect? Signs and symptoms. What does death look like? And so these, excuse me, are videos that talk about that. So again, this might be difficult. So, use what's useful for your learning. What does dying look like during the final days of life? This is, I believe, is actually a nursing student talking about what she witnessed. What can be seen immediately before and after a person dies. So those are just some videos to provide more information to you. Let me leave the student view here. And there we go with that. We went over that. I think we covered everything. What else am I thinking? Your health promotion projects should be turned in. If you haven't gotten them in, then please do your best to get them in sooner than later. And what else am I thinking? The quiz. Let me go back to the home page. You have the week 8 quiz and also those 2 surveys that I mentioned in the Welcome to Week 8 announcement. They're also in the module. I also wanted to mention that if we can get 80% of students to complete a survey, so for example, the course feedback wrap up, again, that is anonymous. If 80% of the students complete that, then students will earn 2 points to their grade. And then the same with the instructor evaluation, which again is a Google form. If 80% of the students participate, complete the survey, then students will earn 2 points for that as well. So it's kind of like having points for doing the survey, I guess is what you would say. It's one of the few ways that I can give extra points. So there's that. So you know how to get a hold of me. Please feel free to make an appointment if you have questions about anything. There is not a final exam. You have the week 8 quiz. The final exam is actually a combination of your journal entries and your health promotion campaign project. And so hopefully you have learned some things. So it's been my pleasure to help walk with you through this journey of growth and development. And again, please let me know how I can support you, and have a great week. I will check in midweek. And I hope everybody has a great week and great rest of your summer. So I will stop sharing. There we go. And then I will stop recording.